Hi viewers, some technical issue due to heavy rains, in Chennai. So welcome to the Facebook live session on a role of oral and maxillofacial surgeon in head and neck region. Recent developments in maxillofacial surgery have made this surgery an extremely successful one in treating facial bone deformities. In short, maxillofacial surgery helps an individual look better due to the correction of the underlying bones, such as the jaws. If an individual is suffering from discomfort due to the damage to misaligned jaws, oral surgery and maxillofacial surgery can be helpful. The Department of Oral and Maxillofacial Surgery at VS hospitals focus on treating many diseases, injuries, and defect in the head, neck, face, jaws, and the hard and soft tissues of the mouth, jaws, and face. Together, let us invite one of the finest and experienced maxillofacial surgeon in Chennai and very, very humble and known for excellent patient care, Dr. S. Nachiappan, MDS Consultant Oral and Maxillofacial Surgeon and Fellow in Cleft Lip and Cleft Palate Surgery at VS Hospitals, Chennai. Welcome to the Facebook live session, Dr. Nachiappan.
Hello, good evening.
Dr. Nachiappan, my first question, are people aware of oral and maxillofacial surgery in India?
Oral and maxillofacial surgery is one of the most rapidly expanding specialty. There is, however, a very poor understanding of the scope of the specialty now in Chennai and in India, because the oral and maxillofacial surgery is essential for addressing both the function as well as the aesthetic aspects of the head and neck. But unfortunately, only 30% of medical professions and only 7% of the general professions have ever approached the OMFS surgeons directly.
Okay, that's very informative. Dr. Nachiappan, is oral and maxillofacial surgery is often referred to as the bridge between medicine and dentistry. Can you educate us?
Yes, as you said, oral and maxillofacial surgery is an interesting and fascinating field that forms a bridge between the medical and the dental professions to resolve many clinical issues related to head and neck regions. The OMFS, known as dentists in many medical fraternity and as surgeons in dental fraternity.
Thank you, doctor. What is oral and maxillofacial surgery?
In simple terms, oral and maxillofacial surgery is a specialty in dental surgery who treats the entire craniomaxillofacial complex. That means the anatomical area of the mouth, jaws, face, skull, head and neck, as well as the associated structures with it.
Thank you, doctor. What is the difference between maxillofacial and craniofacial surgery?
Craniofacial means any surgery which is done above the anatomy of the above the anatomy of the floor of the orbit, like say above the eye. If anything is operated, it is called as craniofacial, and below the eye, whatever we do surgery is called as maxillofacial surgery.
That's great. That's great. Very interesting, doctor. Where do maxillofacial surgeons work?
Most of the maxillofacial surgeons work in the hospitals, in corporate hospitals, in large in large medical centers, and in dental practices as a private practitioners as well. And there is also a teaching opportunity in different parts of the hospitals in rural areas, in private practices as well. Yeah,
that's good. That's good. What does craniomaxillofacial mean?
As I said, craniomaxillofacial not only involves the mouth, jaws, face, it involves the skull and the associated structures as well.
Okay. Dr. Nachiappan, what is maxillofacial trauma and who treats it actually?
Maxillofacial trauma is an injury to any face or jaw. The facial trauma may be present with small skin lacerations or burns or any obstruction to the nasal cavity or sinuses, or damage to the orbital sockets, or fracture of the jaw bones, or missing or broken teeth. These all things are mostly treated by only treated by maxillofacial surgeons.
Okay. That's interesting, doctor. What is orthognathic surgery means, and is it a safe procedure to do?
Orthognathic surgery is otherwise called as a corrective jaw surgery, or it is a aesthetic surgery where it is designed to correct the conditions of the jaw and the face, which is related to any structural growth or airway deformities or due to temperamental disorders or due to malocclusion problems arising from the skeletal disharmonies. So the and even due to where in case where the orthodontic treatment where the braces cannot be placed in certain patients where surgery to be done first, we do a orthodontic surgery, which is primarily a cosmetic surgery that is done before any procedure. Yeah.
Thank you, doctor, for educating us. Do dentists perform jaw surgery?
No, dentists along with the orthodontist and maxillofacial surgeons will work together to determine whether which candidate is for orthodontic or cosmetic surgery. And the oral and maxillofacial surgeons determine which corrective jaw surgery procedure is appropriate and performs the surgery.
Thank you for clarifying that, Dr. Nachiappan. What are the subspecialities in maxillofacial surgery?
There are subspeciality means there are humpty number of subspecialties in maxillofacial surgery. First, I talk about the cosmetic facial surgery, which involves the correction of the eyelids or nose or face lifting procedures or lasers, which is done for cosmetic purposes, which is very frequently done in Europe countries or other Western countries. Then comes your craniomaxillofacial traumas, where the injury or trauma to the any of the face of the eyeballs of the zygomatic regions or to the soft tissues, that is craniomaxillofacial involving the cranium as well. And coming to craniofacial surgery or pediatric maxillofacial surgery involves the including the surgery of the cleft lip and cleft palate for the deformity of the patients from birth. And also there will be all the pediatric patients, they have a deformity of the skull at birth. There will be a bigger skull or smaller skull. That deformities can be corrected at the age of 1 year or 2 years. So that is one specialty. Next one is head and neck cancers, where we deal with all the head and neck cancers of the mouth, jaws, and the neck. And the other specialty is we have a orthodontic or cosmetic surgery, which deals with the correction of the deformity of the jaw, either upper or lower jaw or the chin or deficient mid face, like that. We can bring it forward or push it back. That is one of the cosmetic procedures. Then we have temporomandibular joint disorders or diseases, which is called as TMJ diseases, where due to TMJ problems, patient will have a severe pain, and we deal with that. Usually these TMJ problems will come in the younger age group, and it also affects the IT people who are very stressed out. And next sub-specialty is salivary gland pathologies, where due to salivary gland diseases, we have due to salivary gland pathologies, we have diseases, and we also treat salivary gland diseases like calculi or any tumor in the parotid gland or the submandibular gland. We treat that well as well. And other specialty like facial reanimation for facial palsy patients who have a defect in the facial nerve due to any tumor or something. They have removed the parotid gland and they have a deficient. We can do a facial reinnervation also.
That's quite a few subspecialties, and that was very elaborative, Dr. Nachiappan. Thank you so much. What is the difference between the plastic surgeon and the maxillofacial surgeon?
Plastic surgeon does cosmetic work, more of a cosmetic work. That cosmetic work is mainly the specialty of plastic surgery is a specialty that is dedicated to reconstruct the face and body defects due to birth disorders or trauma or burns or diseases. Plastic surgery may be divided into two groups: reconstructive surgery as well as the cosmetic surgery. Reconstructive surgery, because of any diseases or tumors or any like that, when we remove that part, we need to reconstruct that part. So that is one part of reconstructive plastic surgery. And other one is cosmetic surgery, where at birth we have a defect, we need to correct it. That is called as a cosmetic surgeries. And maxillofacial deals with all the other rest all what I said now, all the rest all cosmetic procedures or jaw procedures or any diseases, any infections within the head and neck region will be done by a maxillofacial surgeon.
That's great, doctor. What are all the treatments does maxillofacial surgeons do?
First, the maxillofacial surgeon starts with a simple extraction of the teeth, followed by wisdom teeth removal or impacted teeth removal, which is common at the age of 17 to 19 or 20 years, where they suffer with the impacted tooth. And next comes facial trauma surgery, where it is a bread and butter for every maxillofacial surgeon to treat the facial traumas, including the head and neck regions. Then clinical entities or the facial asymmetries, as I already told you, is a great challenge for any operating surgeon. Like orthognathic or cosmetic surgery will correct the dentofacial deformities which is present. And we also correct the cleft lip and cleft palate patients who have craniofacial syndromes at birth, which has a multidisciplinary approach, and it is a teamwork. Not one surgeon can do, it is a teamwork of this one. And we also treat oral and maxillofacial pathologies like any cancer or any tumor which is present in the head and neck. And we also treat the head and neck cancer separately alone in the head and neck regions with the help of a plastic surgeon as well as an oncosurgeon, sometimes together if the tumor is huge or large. And we also treat the temporomandibular dysfunction or disorders which may have a severe pain in the TMJ region or temporomandibular joint region with clicking sounds, or patient inability to open the mouth, or sometimes they have severe pain while getting in the morning, like stiffness, like joint stiffness. And we also treat cosmetically like rhinoplasties, where rhinoplasty means the correction of the nose, which is done for the aesthetic purpose. So these are the things we usually do.
Thank you, Dr. Nachiappan. Dr. Nachiappan, basically, as you mentioned earlier, between the difference between dentist and maxillofacial surgeon, what are the reasons to consult a maxillofacial surgeon? For example, as a common man, we just cannot straight away, get appointment with maxillofacial surgeon. As a common man, we don't know about it. What are the reasons could be?
First one, pain in the teeth, especially the wisdom teeth, which has severe pain, and impacted teeth as well, where you have due to wisdom teeth pain and you can't, that's a severe pain which causes a severe pain during night times. And any swelling or lump in the head and neck regions, first you should consult the maxillofacial surgeon and diagnose it, what the lump is or what the swelling is. And the third thing is, if there's any non-healing ulcers which is present in the oral cavity, which is there for more than 2 weeks continuously without healing, or with after taking tablets and not healing, then if there is any infections due to negligence of the patient, the infection will grow off into a diffuse swelling in the face, and that is also an emergency treatment where you need to see a maxillofacial surgeon as well. And if the patient has undergone any extraction before and patient wants to replace any missing teeth, and dental implants is the latest one which has been in the field for more than 15-20 years, and that also the maxillofacial surgeon is very versed in, very expertise in dental implants by placing a missing teeth, either single teeth or a complete jaw. Then, as I already told you, if there is any pain in the temporomandibular joint regions, it causes severe pain and is very disturbing. That also can be treated by a maxillofacial surgeon. And any salivary gland pathology, if there is any less salivary production in the oral cavity, or if there's any lump in the region of the parotid region, we can come and consult the maxillofacial surgeon as well. And then any trauma in the head and neck, like any road traffic accidents, or sports injury or industrial injuries or assault or any type in the head and neck region where there's any fracture or even a simple laceration, can be treated by a maxillofacial surgeon. And last but not the least is a obstructive sleep apnea. What is obstructive sleep apnea? It means, as the name suggests, it is an obstruction of the sleep during night times where people unknowingly will get up from the bed multiple times, and they feel very difficult to breathe. This is called airway obstruction. Due to obstruction, that's a condition called obstructive sleep apnea, where maxillofacial surgeons play an important role in increasing the airway by bringing the upper and lower jaw together forward, or doing certain procedures to relieve the airway. So these are the list goes as on. So these are the basic list where patients with any pain or any swelling or any infections or any annoying things or any difficulties in even in swallowing, even in speech, sometimes that maybe causes cancer in the throat or something, can come to oral maxillofacial surgeon for consultation.
That was very educative, Dr. Nachiappan. Dr. Nachiappan, how would you describe your work, and can you tell us about your practice?
Most maxillofacial surgeons start with the work. My work is by screening the patients who walks in, and after screening, we'll investigate what's the problem. After we listen to the patient's problems, we investigate what's the problem by X-rays or any scans. After that, we diagnose the problem, and then we treat the problem either surgically or conservatively according to what problem the patient has. And we have a follow-up of these patients in every 2 months or 3 months, depending upon what case we do. This is my work pattern which goes on. And according to my practice, I completed my MDS in 2006. And from 2006 to 7, I did my fellowship in Cleft Lip and Cleft Palate in Nachiappan Dental College, Chennai. And I was working as a senior lecturer, and I was doing my fellowship there. And afterwards, I went on to work in SRM Katangattu Dental College for 3 years. That is a fantastic 3 years of working experience there for me, because there are only 5 young guys and one female staff who are young blood that time. And we had a lot of opportunities to do surgeries there. And after that, I came to Satyabama as an assistant professor in 2011. From 2011 till now, I am working in Satyabama Dental College. This is my academic part. As well as in my private practice, I had a private practice in the beginning for 3 years. Then after that, I shift to Velamal Family Clinic, where the Velamal Schools group, I started a Velamal Family Clinic and Velamal Dental Clinic, where I was heading the dental wing there for more than 4 years. And due to personal reasons, the Velamal has closed the family clinic. And afterwards, I thought I need to settle in one place, and I had and I want to start a dental wing at a multi-speciality hospital. That's where I came into a picture in VS Hospital, where I got a vacancy there. Then I met the management of VS Hospitals. Then I became a part of VS Advanced Dental Care, and we started the VS Advanced Dental Care in the year 2019 June, and it's going to be almost 2 years since I started here. And I have a wonderful working experience here. And we are treating a lot of cancer patients. You all know, VS Hospital is known for cancer patients for more than 50 years. And we treat cancer patients as well as the general public who needs dental care.
So we can call you Professor Dr. S. Nachiappan?
Yes, definitely.
Thank you so much, Doctor. Dr. Nachiappan, what is your take-home message?
Despite all the advances in oral maxillofacial surgery in our country, still there is a large number of populations with untreated head and neck conditions and diseases who present since birth, who report to oral maxillofacial surgeons only at the advanced stage, owing to lack of awareness, ignorance, as well as improper referral from the doctors. So oral maxillofacial surgery is critical for addressing any injuries or deformities or maxillofacial diseases of all. So there is a need for us to promote and increase the awareness regarding the wide spectrum of work performed by oral maxillofacial surgeon team to the general public as well as the medical fraternities. This is my take-home message.
Thank you so much. Thank you so much, Doctor.
And one more thing, as I'll advise the patients to visit the dentist at least every 6 months once. Either you have a problem, don't have a problem, it's okay. Just visit as a family and have a family dental doctor who knows you well and who can advise you even over the phone or over the gadgets. It'll be easy. And at least 6 months once have a dental checkup. Everybody, even the pediatric and the young group, geriatric, all the patients can come and walk in and have a dental consultation once in 6 months.
Thank you for that advice, Doctor. Dr. Nachiappan, thank you so much for educating us regarding maxillofacial surgery. In fact, most of us didn't know, the difference between the dentist and the oral and maxillofacial surgeon. So thank you so much for your time. We
Thank
know that you stayed back in the hospital in spite of heavy rains. You
Yes.
know, we want you to go back safe home. So do take care.
Thank you.
Thank you so much, viewers, for joining VS Hospital's Facebook live session today. You know, November is known as Lung Cancer Awareness Month. Next Thursday, that is 18th November 2021, please join us for awareness on lung cancer with Dr. S. Suresh, you know, one of the few oncologists who have specialized both in radiation and medical oncology. Dr. S. Suresh, consultant medical oncologist. Till then, stay tuned. Thank you. Take care. Thank you, Dr. Nachiappan.
Thank you. Thank you very much.
Thank you.